that's resulting in the access to information is going to get really hard. It's going to get very, very hard to write and communicate with the hearing population to get those kinds of information or to get that kind of healthcare from the healthcare sector. So the access to information regarding going to the hospital and getting treatments, getting medication, they can't really get those informations because it's not accessible in sign language. So they don't really know what is going to happen at the hospital. I'm going to get those kinds of medicines, those kind of pills, what I'm going to do with it, and also the side effects from the medications. Often medications have some kind of side effects, but the deaf and hard of hearing really lack those kinds of information about the side effects. And they aren't actually, they don't know the severity of the side effects. So they get a bit, they actually hold back and taking the medicine or going to the hospital and talking to the doctors because they have seen that you get these severe side effects, and then they just hold back on taking the medicine altogether. And that can result in hurting the deaf people in the long run. And also, that disability can get worsened, and they can actually get the risk of dying. And regarding the side effects, they can see, oh, we don't dare to take this kind of medicine because now I'm experiencing these kind of side effects. But actually, they should continue a program of using those kinds of medicines, but they don't really dare because the side effects are scaring them. And also general information regarding healthcare. They don't really have the accessibility to these kinds of information. They are not really. They don't really know a lot about healthcare or what kind of symptoms you need to know regarding cancer, symptomatic cancer. They don't get it in a good time before they could actually get some good treatments. So their chance of surviving life-threatening diseases like cancer is very low. And regarding deaf mothers who are pregnant, they don't always know. They don't know a good health hygiene. They need to. One second. This doesn't interpret. They need to avoid. They need to avoid. Some kind of side effects regarding their pregnancy, and also regarding the birth. There could be a lot of complications in which they don't know because the general knowledge regarding health during pregnancy is lacking. So when we look at those points, there are actually big consequences for the deaf. They don't get the healthcare they need because they can't communicate with the healthcare professionals, or they get maltreated because the communication is really hard for the healthcare professionals, and the deaf they can't say, oh, my tummy is hurting, or yeah, you can look at this, you can see this, give me these kinds of medicines to take care of that. So the healthcare professionals don't really know how to treat them, and the deaf people don't really trust the healthcare professionals because there's a lack of communication. We actually hear a lot of stories from our member organizations in which deaf people have contacted. They say that this deaf person is actually deaf. And they don't really know why the person died. The person just died. They started throwing up blood. They went to the hospital. They couldn't communicate with the healthcare professional, with the doctors, with the nurses. So that's why the person died. We hear about mothers during pregnancies. They start feeling ill. They get pains in their stomach, but they don't really know how to handle it. So they think, oh, we'll just wait it out. We'll just wait some days, or maybe they go to the hospital a lot late. So that's actually the consequence is that when they have a deaf-born baby. So it's actually some banalities that could be easily avoided with good communication, and they really aren't severe, but people die of this because there's a lack of communication, because they have a lack of basic knowledge regarding healthcare treatment. They lack the information in sign language. The information are accessible in text or text-wise, but the deaf and hard of hearing maybe can't read or doesn't read those kinds of information, or actually misunderstands the information on text. I was actually in Ghana last week, just returned home. We met a lot of deaf people, of course, and of course we were talking about the corona pandemic. And I asked them, so are you vaccinated? They will, no. Some of us want to get vaccinated, but we'll wait. They'll wait their turn. And other people, actually, the most of them wouldn't want to get vaccinated. So I looked at them and I was like, I'm just curious, but why don't you want to get the vaccination to corona? Because people are feeling severely sick. And they were like, they have heard on social media, on Facebook, that the vaccines were dangerous and people actually died because of getting the vaccines. And they heard that a lot of European countries has actually thrown out a lot of vaccines, from example, from Johnson & Johnson and AstraZeneca, because of the side effects. So European healthcare authorities have actually thrown out all the vaccines. But they say our healthcare professionals are actually stupid, so they have just received all those abandoned vaccines, but it's based on misinformation. They don't know the real story. And that's why I'm thinking this corona pandemic it's so important that the deaf people get the right information from the healthcare authorities in sign language, not information through Facebook. Because the information at Facebook doesn't really have a lot of high-level credibility, and there's a big chance of misinformation. So if you only follow Facebook, maybe it's written in really poor English or another language with poor grammar. It's not in sign language. There are information, maybe also in sign language, because people have read some text and then translated it themselves, but it's actually misinformation. So when the deaf people see this, they don't believe the healthcare professional, they believe their friends on Facebook. And that's why we at WFD have a big responsibility in ensuring information regarding healthcare in sign language, both of course, in the hospitals, in the clinics with pharmaceuticals, regarding the medicine, side effects, general healthcare, and also in the also regarding the pharmacists, they need to have information accessible in sign language. So how do we do this? There are actually a lot of different methods. We can make sure that the deaf also have all the time have a right to a sign language interpreter. They can go to the healthcare facilities, they can get an interpreter, something in which the deaf don't have to pay for themselves, but the clinic pays for or the hospital pays for. And often in a lot of countries, the deaf have to pay out of their own pockets to get a sign language interpreter. And that's why they don't want to get a sign language interpreter with them when they're going to the hospital. So we need to get so they can get the right treatment, not get more treatment. So if we look at the healthcare sector and the hospitals and at the pharmacists, we need to have information readily available in sign language. So the deaf know, or we need to have the pharmacists and healthcare professionals to know some signs, so they will be able to communicate with the deaf people to handle just a lot of situations, to get a bit more clear communication through, or just to make sure that what they have written on this pamphlet is actually understood by the deaf people. And if they then feel that the persons don't really get the information which they're telling them, then the healthcare professional can contact someone or get an interpreter and make sure that the communication is going through. And also public knowledge from healthcare authorities regarding corona, for example, and other healthcare informations need to get translated in each country to their sign language. That's actually a collective responsibility that we have at WFD and in the world to make sure that deaf people and hard of hearing have the access to information and get the use of their human rights. Thank you so much.
Thank you so much, Casper. Our next speaker is Kenneth Beatrice David. Now, Kenneth is from Nigeria originally, but is currently doing a Master of Science in Pharmacology and Drug Development at Hull York Medical School at the University of Hull in the United Kingdom. I'd like to welcome Kenneth. Thank you.
Yeah, hello everyone. I'm so excited to be here. I'll be speaking on the topic pharmaceutical care approach to hearing loss. It is important that we know what hearing loss is and how we as pharmacists can be able to help in the management of this condition. The outline of the presentation is on the next slide, and we would see what hearing loss is, the signs and symptoms, and ways of managing it and the role of pharmacists in its management. Hearing loss, as we all know, is the partial or total inability of an individual to hear sound in the same way as other people. It can either be temporarily or permanent. And it does not start all of a sudden. It usually starts gradually. And there are a number of factors that result in this condition, each of them affecting either the outer parts of the ear, middle parts of the ear, or the inner parts of the ear. You can see all of that on the next slide. Now, the outer ear is usually affected by cerumen, also known as earwax. Earwax is a natural substance in the ear canal that has both lubricating and antibacterial activity. It usually dries off on its own and actually falls off, but oftentimes it can accumulate and result in hearing loss. And that's one of the reasons why many people make use of what we call a cotton swab to remove that. But it's highly discouraged because it can actually push the earwax further into the ear, thereby complicating the condition. So if you're concerned about the accumulation of wax in your ear, or you are experiencing symptoms like dizziness, ear pain, plucked sensation, ringing in the ear, please consult a pharmacist or your medical doctor. We also have infection of the outer ear, which can result in hearing loss, perforations. For the middle ear, infections can cause that. Otosclerosis and some form of tumors can result in hearing loss as well. For the inner ear, as we get older, some tissues in our body degenerate, including some tissues in the ear, which results in hearing loss. Noise exposure can also affect the inner ear. Some medications like gentamicin, injuries, and some tumors as well, they can all cause hearing loss. On the last slide, I'll speak about a medication that has been proposed to be used in regenerating worn out tissues in the ear. I will see how it goes. Then we have different signs of hearing loss, and most of them are not really observed in good time. Okay, but then if you are having any difficulty in hearing sound in the presence of some background noise, you could be experiencing that. If you speak too loudly, if you're having difficulty hearing from a distance, or if people around you tell you that the volume of your TV or radio is too loud, or if you are having difficulty understanding the if you're having difficulty understanding soft speech or female and children's voices, or if you are having to ask people to repeat themselves over and over again, then there's an issue. On the next slide, to look at the treatment options. The treatment options oftentimes determines on the cause of the hearing loss. If it's caused by an infection, it would be wise for us to arrest the underlying condition. And sometimes it get better on its own, but can be treated with either medicines or some simple procedure. We can make use of steroids in the treatment of hearing loss depending on the condition. If the hearing loss is caused by accumulation of earwax, we have ear drops that can be used to soften the earwax and removed either by irrigation or microsuction. As we get older, okay, hearing loss as a result of advance in age may be permanent. So in that case, you need hearing aids, hearing implants, and you may have to rely on some sign language or lip reading. On the next slide, we'll look at the different types of hearing aids, depending on the severity. The pharmacist also has a role to play, and in the management of hearing loss. I can see that on the next slide. Next slide, please. As we all know, pharmaceutical care has been defined by Hepler Strand as the responsible provision of drug therapy for the purpose of achieving specific outcome that improve the quality of life of the patients. In this case, now the pharmacist works with and for the patients in order to optimize the outcomes of the medication therapy. And the outcomes can be, one, to manage the condition. That means to manage to manage the condition. Another one is either to eliminate or reduce the symptoms of hearing loss, as we mentioned earlier. Then we can also arrest or slow the disease process. Our pharmacists can help in the management of hearing loss by assisting in spotting the hearing problem, but this is not as easy as we think. It may sound straightforward, but it's very difficult for the patients and the pharmacist as well, as it's not obvious to know when somebody is having hearing loss, as it does not develop abruptly. We can help in educating patients about the signs and symptoms of hearing loss. We can also help in advising patients about where to go to get help. We can provide correct information regarding medicines to individuals with hearing loss. We can also buy what we call the tabletop loop system. That is not very expensive, but it does a lot of things in assisting people with hearing aid to listen more. Then consultation rooms or dispensaries can have signage and writings on the wall that can help patients to understand what the pharmacist is actually saying. Then if you cannot help, do no harm. So that's why we advise for referral. If you cannot help the patient, you refer him to a GP or an audiologist who will manage the condition effectively. As I made mention on the fifth, that we need a loop system. Now this is how the loop system works. The loop system, it works by amplifying the sounds being made in the amplifying the sound and making sure that the patient using the hearing aid listens very well. It is not available at all time. It's very expensive, but we can get a simple one that we can use. Next slide, please. Inadequate communication communication is key. If there's no communication between the pharmacist and the patient, the whole pharmaceutical care that we're talking about may be affected. Communication between it's very, very important, and we can improve that by using clearer warnings, making writings legible, and we can be able to speak using simpler languages. If you print out information with pictures to highlight warnings and when to use medicines, it will help very well. One method I use as an opportunity to do intern at the National Ear Center, and one method I used in helping patients with hearing loss was by making them to repeat things I say over and over again, over and over again.
Kenneth, you are muted. We cannot hear you. Kenneth?
What about, can you hear me now?
Yes, now okay. Thank you.
All right, I was opportunity to intern at the National Ear Care Center. And while I was there, one of the approach I used was by asking patients to repeat what I say repeatedly over several times. Now, this is because I observed that most of the patients are not really comfortable to like openly say that I'm actually having difficulty hearing or I have hearing loss. So if you say anything, they'll just be nodding. And I've also observed that most of the patients that have hearing loss always look at the mouth of the person speaking in order to understand what is being said. And that is one approach that I recommend that most pharmacists should also adopt. And instead of writing a lot of things, giving an information package that have lots of information, it can be written in a way that people that have hearing loss can actually understand. Since they cannot hear, at least they can be able to read. On the next slide, you can see the ways by which you can prevent hearing loss. It's not always possible to prevent it, but there are some simple steps that we can take to reduce the risk of damaging our hearing. And this include one, not having our television, radio, or music on too loud, using headphones in order to reduce the amount of noise that enters into the ear. We can use a protection if we work in areas in factories that have loud noises. Then if you're in parties or if you're in an environment or an event that the noise is too high, you can be able to use something to cover the ear. Next slide. Then we should also not use cotton swab indiscriminately. If you need to use it, please make sure you see either a pharmacist or a doctor or an audiologist. That would help. As I mentioned earlier, we have a drug being manufactured by a pharmaceutical company in US. And the name of the drug is the FX322. It has the potential to repair damaged inner ear by regenerating the hair cells and restoring hearing. But unfortunately, in 2019, after the result of the clinical study was out, the company was not really impressed with the outcome, and hence it was discouraged. So as it is now, I'm not sure there's a medication currently that's been developed that has an ability of regenerating any tissue that's been damaged. So it is very important that we protect our ears and also follow advice as best as we can. Next slide, please. Now, hearing is complex, is very complex and very, very important. Hearing loss can have various causes. Yes, some can be treated, others are not. Hearing loss is still widely underdiagnosed and untreated. People with hearing issues, they have lots of issues. It has an impact on their social life as well as professional life. That pharmacists plays an important role in patient motivation of seeking care. So all hands must be on deck in order to ensure that we reduce the prevalence of hearing loss. Thank you for listening.
Thank you so much, Kenneth. Our final speaker tonight is Fiorella. Fiorella is from Costa Rica. She is a pharmacist and she is the coordinator of a program. Just trying to find it. So it's a program it's a deaf-led company called Accesio Visual. I apologize for my extremely poor Spanish. And she's the coordinator and pharmacy consultant of its health program, which is called Salud Inclusiva. She's also an associate professor of the courses for trainings of health professionals in Costa Rica in sign language. So if we could please make Fiorella welcome.
Thank you very much. Good morning, good afternoon, and good evening, everyone. As mentioned, I'm a pharmacist in Costa Rica. My name is Fiorella Donato, and I have worked closely with deaf people for several years now. I collaborate with this company, Accesio Visual, and we have a program called Salud Inclusiva, which means inclusive health, that focuses on providing healthcare information for the deaf population. I'm honored to be here and honored to share with you this information, and I hope it can help you improve your communication skills with your deaf patients. I would like to start my speech by pointing out that when it comes to the deaf population, it has many variables that need to be considered. If the person has born deaf, or if he has acquired hearing impairment, if he uses a hearing aid, or if he's a profound deaf, if he's a user of sign language, or if he has been oralized, if he prefers to read lips as a way of communication, its level of education, among other many variables. These variables influence the way a deaf person develops, and also if he acquires the deaf culture as his own or not, which leads us to a very profound concept that is the deaf culture that I'm not going to delve in this speech. But what I do want to point out is that the way a deaf person perceives himself is going to influence his preferences on the communication. That being said, I would like to clarify that the tools I'm sharing with you tonight or today might need certain adjustments depending on each individual characteristics. Firstly, we must understand that there are differences between the type of communication of hearing people and the type of communication of the deaf. Hearing people communicate using vocal and auditive communication. Hearing people mostly perceive their message through the hearing sense and speak to communicate their message, whereas deaf people use gestural and visual communication. This means that they use gestures to transmit their message and mainly their vision to capture others' message. Since this communication has a different dynamic, the deaf have a whole different way of perceiving and understanding the world. Maybe this is why hearing people believe that the deaf cannot communicate, when this is actually a misconception, because they do communicate, but not by using the same type of communication that hearing people use. Also, it is of utmost importance that we comprehend what the mother tongue for someone means. The mother tongue defines how a person thinks or elaborates his ideas and how he learns the concepts of life. For example, for a Costa Rican, Spanish would probably be his mother tongue. But if he gets to learn a second language, the first thing that will come to mind when in his thinking and analyzing process is going to be in Spanish. The mother tongue of the deaf is sign language, since one of their senses is absent or diminished, and their communication is carried out in a visual and gestural way. Their thinking and analyzing process occurs in their minds in sign language, meaning they relate the concepts using this language. And here I would like to clarify that not all the deaf people decide to use sign language as their primary language, or even have the opportunity of being taught in sign language. Nevertheless, the visual and gestural communication come to them naturally. Therefore, this mindset I'm telling you about applies to them as well during the communication dynamics. Next slide, please. This leads us to understand why we need to take into consideration all that's been said during the design of our pharmaceutical care techniques. If we pretend our message to be effective when it comes to transmitting health information, we must acquaint the receptor of that information. So if we know that the deaf population communicates in a different way than the hearing population, we cannot use the same tools or materials we use for our hearing patients with our deaf patients. Adjustments need to be made, taking into consideration the characteristics of that communication of the deaf. Once we get that, not only our vision of the way our patients might be understanding our message is going to change, but also our creativity will focus on different ways to provide effective pharmaceutical care for them. For example, now that we know that the deaf perceive the message mostly in a visual manner, we should rely on a strong manner on visual aids. By using colors or lights instead of sounds, we are going to choose probably a picture over a speech, or the use of lights to call someone's attention instead of a microphone, as it normally happens. And now that we are going to talk about the pharmaceutical care for the deaf, another aspect that we have to consider is the difference between the types of tools we might use for providing health information or health education. These tools can be focused in two different ways: providing the message for the deaf patients, or training the pharmacist on how to educate the deaf patients. For the first, the audience is a user of the visual and gestural communication. And for the latter, it is a vocal and hearing audience. So again, the message should change according to their specific needs. Now that this is covered, I will share with you the tools we have come up with in Salud Inclusiva for the pharmacists to use with their deaf patients. Next slide, please. The first one is visual aids. The visual aids are an excellent tool to support communications with the deaf. For example, videos. Throughout the program, Salud Inclusiva, we created videos regarding several topics, not only related to pharmacy, but also to health topics in general. As they are intended to be seen by the deaf population, they were filmed having a native sign language speaker on the front page. and not as usual that the sign language interpreter is in a box aside. Therefore, the main language is not Spanish, as it is in Costa Rican's case, of course, but Costa Rican Sign Language, Lesco. So having these videos in Lesco is an advantage because from the beginning, the message is designed considering the best way it could be transmitted for the deaf and therefore understood by the deaf. This also means that the message is presented in Lesco and then translated to Spanish, and not the other way around. This tool relates to the next one, and next slide, please, which is the standardized methodologies to elaborate materials for the transmission of information for the deaf. We came up with a methodology that focuses on how to elaborate the videos we perform. First, the healthcare professionals write the script in Spanish, as is our case. Then they explain the script to the deaf of our team. The deaf translate the script to Lesco, the Costa Rican Sign Language, and once the videos are ready, the healthcare professionals who are also fluent in sign language translate the message to Spanish. This way, the video message is firstly in sign language, and as I mentioned, Lesco, the Costa Rican Sign Language, is translated to Spanish and not the other way around. We believe that success of the tool relies on the importance of designing a proper methodology. In this case, realizing that the main audience for these videos is the deaf population. The third tool I want to talk to you about is having guidelines for the training of healthcare professionals regarding topics related to the deaf community and the social focus of disability. And here I want to emphasize that our audience is hearing people. Therefore, the tool has a different focus than the latter ones. In Salud Inclusiva, we created a guideline using our experience with the project Inclusive Health Education for Pharmacists and Deaf People in Costa Rica, for which we won a fund from the Americas Pharmaceutical Forum, or Foro Farmacéutico de las Américas, and was developed in 2019 and 2020. With this tool, any group of pharmacists in any country can reproduce the training of pharmacists in the topics aforementioned. As I said, the deaf community and the social focus of disability, while addressing the specific needs of the deaf community in their own country, because it can be modified according to them. This is a very interesting tool because, as you might imagine, not all deaf populations in each country are going to have the same needs. They have their own socioeconomic characteristics, different laws, and different fights in the deaf community. With this tool, we can adapt the training to address those needs, and therefore the results are going to be different in each country, which gives a very interesting dynamic to the tool. One of the tools we also utilized for the projects was workshops, with the deaf and the pharmacists working both separately and together. It is very interesting to study the behavior of the participants when they are put to work together. They tend to feel scared in front of situations in which they are not familiar with, but the idea is to force them to face these fears and try to communicate similarly as they would communicate in real life. And they were as if they were to attend a deaf patient. The idea is for them to practice those things beforehand and not wait until that moment comes to come up with some sort of idea. This way, amazing results can come up since they get familiar with the dynamics of the communication, both pharmacists and the deaf, and also get to hear ideas from the deaf population. Having the deaf population's point of view gives pharmacists a perspective on how the deaf might be able to better understand the health messages. And that is the meaning of the famous quote I wrote in the slide: "Nothing about us without us." This first-hand information includes the deaf into their own learning process, and this is very important because we need to respect their culture and not assume from our hearing person perspective what is the best for them, but to collaborate with them to define that. The final tool I would like to share with you is the training of pharmacists and pharmacy students in sign language. Learning sign language opens a whole new perspective for them. Understanding the deaf own language helps them realize the way the deaf understand concepts and improves the development of appropriate teaching skills they are to use with the deaf according to their needs. And obviously, it also facilitates the communication with the deaf that are users of this language. To this day, we designed 2 courses which include specific contents for pharmacy and medicine careers, according to each career's needs. So far, in less than 2 years, we have trained approximately 45 professionals and students. Our aim is to keep working with the deaf and expand our scope to other healthcare careers so that we can keep training healthcare professionals in sign language. These courses include a few theory lessons where they learn about the differences in communications of the deaf and the hearing people. They learn about deaf community and the concept of disability from a social perspective, and not, as they most probably will in their careers, from a health perspective. This means not perceiving the deaf as people who have a disease, as for many years has been thought, but perceiving the deaf community as a minor linguistic community, and learning that the sign language is a language by itself and therefore needs to be respected just as any other language in the world. They also learn about the dynamics of interpretation and its importance, and also some legal aspects on healthcare for people living with disabilities. Our experience has been very gratifying because a new generation full of sensitized people is developing, willing to break misconceptions regarding disability, and the deaf population that has been present for many years and conscious about the importance of having these kinds of tools to be able to provide healthcare to patients in equal conditions as any other patient might get, and mostly important, as they deserve. The next slide, please. If you like to get in touch with us, here's our contact information. Feel free to reach out if you have any questions, or even if you would like to collaborate with our project. I would like to thank again the organizers for having me here. And thank you all for your attention. I will be happy to answer your questions if you have any.
Thank you so much, Fiorella. I do actually have a question, which I think was directed to you from one of our participants, someone called Archu Nekwenti. They were inquiring how can they acquire visual aids for their patients. Now, that might be something that you could help with, but if they are not obviously using Costa Rican Sign Language, we might also need CASPA's influence here, as the World Federation of the Deaf might have resources like this as well. So do you want to start, Fiorella?
Sure. One of the tools I mentioned is a guideline that can be adapted according to each country's deaf population needs. So the idea is to reproduce that same tool, but adapting it to that deaf population needs. In our webpage, we also have some scripts or the scripts of the videos we used, so that it could be translated into the different languages of the world. And then my advice would be to work closely with the deaf community of each country to try to translate it first to the sign language and then to the language of that country. Because as I said, if our audience is going to be a deaf population, the first language of that tool or that video must be in their sign language. And then in the country's language, so that you could have an accessible an accessible tool and accessible video, so that everyone that sees it can understand the message or the health message that we want to provide.
Thank you, Fiorella. FIP did at some stage also make some visual tools, more so to help those with illiteracy problems, but they potentially could be something that could be useful. But Casper, does the World Federation of the Deaf have resources that pharmacists could access to help?
Yes, I would like to just say that you, Fiorella, your method or your approach is very impressive. Really, it's the right way to do it, to include the deaf population, as you said, and that it's their first language. So, and as you said, I really want to praise you and say that is the right way to do it, to engage people. And WFD, we do have a lot of contacts to all our deaf organizations in the 133 countries that are our member states. They do have the resources to develop something themselves. We don't do that, but we do have the contact. So if they do have a representative or a member from your country, then just contact us and we can guide you on who to contact further on.
Thank you. Any further questions from the participants, please put them in the Q&A box. I actually did have a question for all our panelists. With the current COVID outbreak, obviously there are mask wearing mandates. Has that been a problem for the deaf or hard of hearing community, with the fact that they cannot see the person who's speaking to them, particularly for those who I guess are relying on lip reading rather than any other kind of hearing or sign language?
Should I answer that? Yeah.
You can both have a go. We'll go with Casper first.
Yeah, that's true. The mask has created a lot of challenges. There are a lot of people that are, as you said, depending on lip reading, and you do see they're trying to develop these transparent masks that you can use. And as I've understood it, it's not a medically approved mask, so that's kind of a challenge in some countries as well. But some are very fond of those, and I don't know how it's from the health perspective if they're actually approved. But it's a situation where you have to take off your mask so you can just read the lips, and then you can take it on again. I know a lot of people have done that.
Thank you.
I would like to add up there that from a health perspective, you're right. It's not always like the best practice, but if you're like in a safe environment, you could either have some space, like get separate from the deaf person so that he can look at you directly. If he prefers to use lip reading, you could use that technique. And also you could speak through a glass, so that the contamination, in case there is not an issue, and that person can still see you, and you cannot, and you don't have like a whole 60% approximately of your face covered, but improve the communication with that person using that technique.
Okay. Well, it looks like there aren't any further questions from the participants. I would just like to thank, on behalf of FIP, all our panelists today, and also our fantastic interpreters who've done such a good job for our hearing impaired and deaf participants. We hope you've enjoyed this and found it very illuminating, and we hope that you use this knowledge to go back to your pharmacies and to your practice and try and involve and engage more effectively with the deaf and the hard of hearing community. Thank you all very much. So, okay. Looks like there was one other question, if we've still got everybody here. I've got a note. I am aware that sign languages are different for various countries and languages. However, in countries that do not provide access to classes in sign language, what would be the best way to learn sign language that could serve as a foundation for learning specific sign languages of other languages? I think that might need to be Casper and maybe Fiorella. Casper, do you want to go first?
Yeah. Yeah, it is like you said, a lot of people, or a lot of countries don't have courses in sign language, but you can try to learn it, to just go and meet with deaf people, participate in different activities, maybe at the church. There are a lot of churches where they do use sign language, and that way you can try to learn it. Because there is no formal way in learning sign language, and there's very few opportunities to learn it.
Thank you.
Yeah, thank you. I would say the same, like to try to contact the deaf population, try to look for if there's any association of deaf people, and try to get in touch with them, and so that they teach you, because sign language is a very dynamic language, so there are many variables that need to be taken into account. It can be evolutionary, it can evolve, so you need to get in touch with them first.
Now, I also noticed that we've made a lot of talk about sign language. We haven't actually dealt with how we communicate effectively, or resources that are available for those who are still able to hear, but not to the full extent that most of us can. Kenneth, have you got resources that you've utilized in your practice? Because you've, I think, dealt more with hard of hearing or people who've had moderate to severe loss. What strategies would you suggest that the pharmacists could use, given that that is the largest population that we would normally come in contact with?
Yeah, thank you very much for the question. Now, for those that are not having permanent or total hear loss, one approach I used was by like shouting, like speaking a little bit louder when communicating with them. And oftentimes the hearing loss was unilateral, not on 2 ears. So maybe one ear was working well, and the other one was not working well. So I look for the more dominant ear, then I'll speak to them through that ear. But if it is bilateral, that means the two ears are having issues, then I just have to speak a little bit louder and ask them to repeat what they can hear, or sometimes I write it out and like show them. So that's one of the ways I use in communicating with them.
Thank you very much. Now, I haven't seen any further questions, so I'm not going to repeat all the goodbyes again, but thank you all for attending, and hopefully we'll be able to run future webinars on this topic and on deafness and hard of hearing. Thank you very much, and have a very good morning, evening, or night, wherever you happen to be.